I got an awful lot of questions on my video about the genetics of autism. And maybe I have to make a longer video, but I do want to cover a few points. First of all, it is not a gene. It's hundreds of genes. Second of all, a great number of those genes are de novo mutations. De novo mutations means that it was not inherited. It was genetic, but not inherited. So I can have a genetic condition that neither one of my parents had because I'm the first person to get that gene, because genes change. And we know that the increase of genetic changes is increasing. There are factors that make genes mutate more. Mutation is when genes change, and mutations cause new genes to occur. And this is normal. This is supposed to happen. We're supposed to have gene mutations. It doesn't mean, although often it does, but it doesn't mean that one of your parents had to have that gene and it's obvious where you got it from. It may be, sometimes it is. We do gene testing, and many people have done gene testing, and the gene tests are positive in many cases, but not in all cases, and we haven't even found all the genes that cause autism. We keep finding more. And some of the people who specialize in that field will gene test the patients and say, we may want to gene test you again if it's negative because the gene testing keeps on changing. The idea that a gene means you get a disease, that idea, which we were taught in high school, that's not exactly right. And so genes can be present and they may or may not cause disease. They don't 100% control everything, and genes can get turned on and turned off by other factors. So that makes the situation even more complex. Anyway, I hope that helps. It's hard to explain in a short amount of time.